Hello, my name is Darren. I am a part-time massage therapy student at MRU. I am here today to tell MRU and the community why I will not take the experimental injection. Our president, Tim Raheli, and MRU have not asked us why we will not take the jab. Tim and MRU were once upon a time very big on students' mental health. As the slogan goes, you belong here. But does that apply to students who value the choice of what we want to put in our body without punishment? I have a very long story of dealing with corruption in infectious disease Calgary. I will try to sum it up in a few minutes. It's not COVID, but it has many similarities. Go back to 1995. I was in the 9th grade. I was a regular healthy kid. We were taken into our gym one day and given the MMR vaccine, measles, mumps, rubella. This vax was brand new on the market. I was sick for days after. It was like I got acid reflux overnight. The MMR vax is believed by some schools of thought to be in part for huge spikes in autism over the past few decades. Remember this name. A scientist, William Thompson of the CDC, blew the whistle on these vaccines leading to autism-like characteristics in children. He admits he was complicit in this cover-up. I do not know what was in this vaccine, but I know it changed everything and it affected my immunity. I was given acid-reducing medication and I was put on anxiety medication for 5 years later. During my 20s, I lived a typical party dude kind of lifestyle, and I used alcohol and medications to get by. I knew something more was going on. Fast forward around 10 years later, I was 28 and I slowly made diet and lifestyle changes. Got off the medications I was on, and in my body's natural state, I discovered I had severe fatigue and widespread pain all over the body, and many other symptoms. Eventually, my naturopath and MD concluded I was dealing with a symptom that we call fibromyalgia, a mysterious illness with no known cause. Fast forward 10 years later, I learned to live with fibro, or chronic fatigue as it's also called, and treating it with natural medicines and an anti-inflammatory diet and lifestyle. It never felt right to me that this condition affected so many people, 2 to 4% of the population, yet they did not know the cause. Some of my friends mentioned Lyme disease could mimic fibro. I heard this before, but did not want to hear it. Fast forward another 10 years later. I was halfway into my program at MRU, and I got tested by a doctor in Canada. As I expected, I was negative for Lyme. Yet $700 later, with student loan money, I saw a Lyme-literate naturopath and was positive for Lyme disease in Germany at the world's best testing lab. This explained all my symptoms of this mysterious illness. Canada follows the CDC guidelines for testing. The ELISA Western blot test was created in 1994 and is still used to this day. I was tested on the C6, which is very much a similar test and is believed to be flawed by Lyme-literate medical doctors and naturopaths. Many of us can be exposed to Lyme disease, and it's not just ticks that can infect you. It can be mosquitoes, fleas, and lice. It all depends on our immune system if you're exposed. So I saw an infectious disease doctor, and they termed my German test invalid, and I don't have Lyme disease, and denies me treatment. It is not the doctor's fault, but the system that trains him in making the regulations. One sec here. In a letter from Infectious Disease Calgary, they tell me, and this is good. At the end of 2019 tick season, there has never been a case of Lyme disease that was adjudicated to have been acquired in Alberta. All reported cases are acquired in another location. This is from the former head of infectious disease in Calgary. In addition, they go on to say that 0.7% of ticks that are submitted carry Lyme disease. I would like you to tell that to any of the thousands of Canadians and Albertans living in Alberta with Lyme disease that less than 1% of ticks carry Lyme disease. They go on to say there has never been a proven case of Lyme disease to be acquired in Alberta, yet Lyme disease is diagnosed in Alberta every year. It gets worse than that. The infectious disease doctor at Rocky View Hospital goes on to clear me to donate blood. Yes, according to Lyme-literate doctors and Lyme-literate naturopaths, there is one Lyme-literate doctor at South Calgary Health Campus, we will call him Dr. H for now, that is trained, one in all of Calgary, that knows how to treat with antibiotics. It's too late for antibiotics for me. So the letter goes, To whom it may concern, at the request of Darren, specifically he has requested that I comment on his suitability for blood donation in the context of questionable Lyme disease diagnosis. I have seen him in our infectious disease clinics for the same. Based on clinical and serological assessment, he does not have Lyme disease. He has no restrictions for blood donation as far as Borrelia infection goes. Of course, he should still undergo appropriate screening for blood-borne pathogens as per Canadian Blood Services. So I've seen two of the biggest Lyme naturopaths in Calgary. They both have patients that feel they have got Lyme disease from blood transfusions. These are the same infectious disease doctors we hear every day, and it's not their fault. It's the people that make the regulations. I would like to ask any of the police officers over here, if they can hear me, if they feel comfortable accepting my blood. Do your children feel comfortable accepting my blood? Do you believe me and the people living in Alberta, in Canada with Lyme disease that test positive in Germany yet negative in Canada? Do you believe that our blood banks are tainted or not? Do you feel safe accepting my blood? This is outright criminal, and this goes on throughout the world because Lyme disease is not screened throughout the world. The only way you're ever going to get not screening is if they see a tick bite and you're on antibiotics for 6 weeks. This is similar to the denial of safe and effective early treatments of COVID with ivermectin, hydroxychloroquine, vitamin D, vitamin C, and zinc and antigraphis. That is not going on at our hospitals. It is not the unvaccinated's fault that the people that make the regulations are not treating COVID patients properly. I am in a long-term, very expensive herbal treatment. It is far too late for antibiotics, as I've said before. My body does not detox and clear chemicals like a normal person, so it is very important what I put into my body. This injection is far too risky for me, and I will not be forced to take it. Certain treatments like Right Machine and ozone therapy, remember, bringing disinfectant into your blood. You ever hear that before? And I am basically in a chess match every day of boosting the immune system, killing the bugs, and reducing inflammation. So I have to be very careful what I put into my body. This is one guy's story for not jabbing. I do not think I have any better reason to not jab as a healthy young person that may be in great health, because they might want to keep it that way and do not trust his agenda as I don't. I say to the students, it is time to stand strong as ever, because we really are in this together. And MRU, I will not give him to coercion, bullying, or fear, vaxxed or unvaxxed. We sure as hell all belong here. Thank you.